Hi, my name is Dr. Lexie Wang. I'm a facial plastic surgeon at West End Plastic Surgery in Washington, D.C. Today we're going to be talking about hair transplant and specifically when you should get a hair transplant. Now, first of all, I don't know if all of you guys even know that hair transplant even exists as an option out there, but before we jump to there first, let's talk about natural hair and aging. So there are two types of hairs. We have terminal hairs, which are these big, thick hair strands that hopefully all of you guys have. And then we also have vellus or baby hairs, which are, those fine little bits of hair that are usually along the hairline. In the natural hair cycle, you are primarily growing these terminal hairs, but with time and aging and certain hormonal changes, some of these hairs will convert into vellus hairs, and then some of the vellus hairs will just further die off, and then you've got nothing. And that is unfortunately what causes balding, hair thinning, etc. Now, what can you do? There's a lot of non-surgical options that you can do to try to minimize this. Things like PRP injections, using Propecia, also known as Finasteride, Rogaine, minoxidil. These are all non-surgical options that you can do to try to prevent that natural transition from terminal hairs to vellus hairs. However, once your vellus hairs have disappeared and you are straight on bald with nothing there, those options are not going to be able to do anything for you. At that point, the hair bulb, or where the hairs grow from, has completely died off, and so you can't replace the hair bulb no matter how aggressive you are. At that point, we talk about hair transplant because that hair is not going to come back no matter what you do. So the only way you can get hair back in that area is if you do a transplant. There are several ways to do a hair transplant. It basically all involves taking hair from another part of the body and putting it there to replace the lost hair bulb. So that is when you should be thinking about hair transplant. If you are still at the point where you have those baby hairs, I strongly recommend that you start getting on one of those preventative regimens because that will help you convert some of them back into your terminal hairs, or at the very least preserve them in that very delicate vellus baby hair stage before they disappear completely and all you got left is hair transplant. So that's me on when to get a hair transplant. My name is Dr. Lexie Wang. I'm a facial plastic surgeon at West End Plastic Surgery. We'll see you all next time on Face the Facts.